My name is Paul Kemmeter. I'm a general surgeon, but I specialize in bariatric surgery. I'm in Grand Rapids, Michigan, and I'm part of a private practice that we have 5 bariatric surgeons in our group. I finished residency in 2002, so I've been in practice since then and started doing laparoscopic bariatric surgery in 2003. The most common procedures I perform, typically probably 90% of what I do is vertical sleeve gastrectomy. We do hiatal hernia repairs as well. I do Roux-en-Y gastric bypasses, duodenal switches, revision surgery. That makes up the majority of what I do. I first started using Richard Wolf, and I think it was when I started here in 2003. Prior to that, I was in residency, and some of the instruments, I don't even remember the names of them, but I know they were antiquated. In 2002, I think I did the first laparoscopic common bile duct exploration, and we used just some rudimentary equipment, and it was a struggle. So in 2003, when I started doing bariatrics and got to use Richard Wolf instruments, it was night and day difference. It was so much better. I was fortunate when I came and joined the practice that I'm in currently. My senior partner had already picked out all the Richard Wolf instruments, and so for 22 years now, I've basically been able to use Richard Wolf. And we've worked at about 7 different hospitals, and every hospital I go to, we ask for a Richard Wolf tray of instruments. So it's been nice. When something works, you don't deviate from it. The thing about laparoscopic instruments is it's all about ergonomics. There's a lot of stress when you're doing surgery, and there's stress on your shoulders, but there's stress on your hands as well. And so instruments that sit properly in your hands are key. One of the things that Richard Wolf has done is worked obviously with surgeons saying, hey, how does this fit inside your hand? And they've done an improvement with the ERAGON upgrade that fits in the hands nicer than even what the older ones did. My overall impression of them is I like them. If I didn't like them, I wouldn't use them everywhere that I go. I think what's great about the ERAGON system is, again, there's a wide range of tips and shafts that you can get for it. We use a lot of the DeBakey because we're doing a lot of intestinal work, and it's atraumatic when we do it. I tend to use the smaller tip that we call it the box grasper. That's not the real name, but we tend to use that as well. In particular, when you're in an abdomen where you don't have a lot of length like you would need with the DeBakey, and you can then use the box grasper, and it's stronger. So when I go to suture, I can grab a needle with it. That's better. So there's just a wider range of instruments that you can use, which is beneficial. I think the ERAGON system, again, is probably, from a standpoint of the support staff, so the scrub techs being able to just click them into position is super nice. I don't ever hear anything, which is what I want, right? So if I hear complaints, then there's an issue that needs to be dealt with. I never hear anything, so that tells me the ease of use is there. And again, on a rare occasion, if an instrument isn't working, the staff know, take the handle off of one and put it on the other. I think it'd be really, really hard for somebody to convince me to go to a different instrument at this time. My muscle memory is there. I don't have to think about it when I'm using these instruments. The advice I'd give to a surgeon who's looking at this would be, again, 22 years, I've probably done, I've done about 6,000 bariatric operations. I can't even imagine how many other procedures I've done with it. And they really work tremendous. The longevity, the trays that we've had are 20-some years old. Now, we're replacing instruments, obviously, as we go, but the longevity is fantastic.
Richard Wolf, Spirit of Excellence.